Hello and welcome to the Print interview. I'm Mohana Basu, Special Correspondent at The Print. And today we have the privilege of speaking with Dr. Ajay Sood, the Principal Scientific Advisor to the Prime Minister. Welcome, sir, and thank you so much for giving
Thank
us
you.
your time.
Thank you.
Dr. Sood was appointed in May this year, and one of the first missions that he has taken up is what is known as One Health. So, can you tell us about One Health and what this concept is all about?
So, One Health actually is an integrated approach to look at humans, wildlife, animals, and also environment in totality, not in very fragmented fashion. Because there is an interdependence of all this. As you know that from the COVID experience, how it can come from animals to how it can come from wildlife to animals, and then it can also come to humans. So it's a very connected system. Now, we have been looking at all these three subsystems separately. It's not that we are not doing it. A lot of effort is on. And there are also efforts in India where One Health concept, looking all the three things together, has already been going on in few ministries. For example, Ministry of Health under ICMR and disease surveillance. We have DBT. We have other ministries which have been looking at it. Uh, so, so we had actually we had a discussion with 6 ministries who are directly doing this for a number of years. So what we are attempting to see that what are the gaps in this integrated approach?
Right.
Because this is something which really spans across many ministries, which also spans across various species, and it also spans across countries. So there is no boundary in this.
Right.
To see is to identify what are our gaps in this One Health mission and see whether the mission approach can bridge that. So that is actually the purpose of engaging discussions on this very important topic, and more so after our COVID experience. We
Right.
know that how it can flare up, how it can put the whole economy to stand still. So this is something we have to be future ready.
Right.
Supposing, I mean, God forbidden, there is something else which is probably which comes up, then are we ready for that?
Right.
So
Right.
COVID has taught us to be ready.
Right. Right. So you mentioned 6 ministries. So I mean, I'm assuming the Science Ministry, Animal Husbandry are part of it. What are the other ministries?
We have, we have the whole list who made a presentation on this. I
Mhm.
can send you that. But Ministry of Health, Ministry of Animal Husbandry and Dairying, we will have Ministry of Agriculture, we
Right.
will have the National Disease Surveillance. So all DBT, all these things are playing a role.
Right. So because agriculture, when we talk about One Health, I'm what I understand is it's not just limited to infectious diseases. We're also talking about food security and the effects of environment and climate change as well. Is that correct?
Absolutely. I said MOEF and CC
Mhm.
is equally a partner, stakeholder in this. So already good thing is that all these ministries and departments like DBT and some parts in DST also, they are looking at this. It's not that it is totally a raw field and nothing has happened. We are already doing it, and as you know, that 2 states have also launched it.
Right.
Karnataka and Uttarakhand have launched the One Health mission.
Right.
So that is a good thing. So we have some preparedness in that.
Right.
So the purpose of taking it up in our office with all these stakeholders was to identify whether there are any gaps,
Right.
not to start from scratch.
Mm-hmm.
That's we are making a very integrated team, and that team will look at whether any policy interventions are needed, whether any support is needed, what is required for the country as a whole,
Right.
not in a fragmented fashion. So
Right.
that's the goal.
So far in the discussions that you've had with the various stakeholders, what do you think is one of the key gaps that you're talking about? One of the key things that need to be addressed first.
So what I'm saying is, first thing which you see is the surveillance. So now in surveillance, there are many methods, right? So the most popular one is the environmental surveillance by various means, right? Now, if such a thing happens, let's say in a given city, and you find there is a possibility of this case, question is how do we communicate? What are our connections? And who are the stakeholders who should be identified, who should be in the loop? All that digital network will be there in place in under this mission, so that there is no gap in our understanding of the what is happening, and also how to take action steps on it. So
Right.
that's one very particular aspect which there. Once that happens, of course, then the remediation also comes. What are our remedial methods? Is it something new that we have to develop a vaccine? Then are we ready with vaccine platforms?
Right.
So, of course, we are ready with the vaccines. I mean, we know that in COVID we have acted very fast, but can we make some platforms ready? For example, mRNA vaccine or CRISPR-Cas based vaccine platform. There are so many other possibilities.
Right.
So, what we are trying to see is how can country be ready?
Right. So, just for the audiences here, at mRNA vaccines have this advantage where you can once you have the genetic code of the pathogen that we're trying to target, you can basically very quickly create a vaccine to sort of
Sure.
fight that. So that is one of the advantages, which is why we need such a platform. Uh,
That's correct.
one of the key experiences that I think, like as a journalist, as the public would like to see is, uh, when an outbreak of this scale of any scale happens, there is some amount of information flow between the government and the public that is very essential. But there is also, because we are in an era where social media is so active, and we do have a lot of not only do we have a lot of misinformation, we also have issues with transparency in what kind of information is available to everyone. So, is there a plan to also address that?
Yes, answer is yes, absolutely yes. That is an integral part of the entire exercise, because as you rightly said, this communication is very important with the public. So it should be a balanced communication. It should not hype anything, it should not hide anything.
Right.
Both the H should be avoided. And that is only possible if we are clear in our mind that this is something has to be communicated in a transparent manner,
Mhm.
so that it does not create a panic for no reason, but it also should not be so dull and drab that people don't take notice.
Right.
So it has to be a balance. So as you know, that communication is an art and science. It has both,
Mhm.
and nobody can know better than you how to communicate better without being frivolous or without being speculative.
Right.
So the science communication is very, very important, and it has to be done in a very balanced manner, so that we don't hide the facts, But at the same time, by some speculative fear, we don't create a situation which is unwarranted.
Right, right, right. Also, when it comes to making scientific policies or scientific decisions around any such outbreak or any such disease, how do you ensure that the team of experts, the opinion of the team of experts, sort of outweighs what the prevailing, political or religious sentiment is? Because we did see a lot of that sort of get into the COVID response during the pandemic as well.
Yeah, no, no, right, absolutely. And this unfortunate pandemic has taught us actually how to do this correctly.
Mhm.
So we learn from this experience, and I will again say that the best remedy is to be transparent and clear in a very objective manner.
Right,
And that is the only way public will trust science.
right,
Not speculative, not fear. So that's not the way it helps anyone.
right,
So there
right.
be, I mean, there have been probably cases like this. We must learn from that and avoid it.
So, coming to the next, aspect of when we talk about scientific research during COVID, we saw that scientists are working at breakneck speed to publish, to get their data out there, which unfortunately also leads to a lot of, low quality data or low quality scientific research papers getting into the system. And that is not just a problem from the pandemic. That's something that we have been seeing regularly. Some very reputed institutes names have cropped up, with allegations of data fabrication or plagiarism or just scientific misconduct in general. So, as your position in the office, in your position, do you think there's something that your office can do to hold such activities more accountable, or to make sure that at least scientists who are, or people who are indulging in scientific misconduct are held accountable or brought to question?
Right. Okay. So actually, it has many aspects to this question. See, this question which you asked actually is not about pandemic.
Mhm.
It's a pan science question. And this has been flagged earlier also. And as you said, there have been cases where some in biological systems, some data has been claimed to be duplicated or reference was not known. I mean, all those things which you are referring
Mhm.
to. Now, all the science academies in the country, three science academies, are very sensitive on this, and they have put out exactly their ethics guideline.
Right,
But over and above that, my predecessor, Professor Vijay Raghavan, also has made, this office made ethics guidelines, and they are in public domain,
right.
right? So now, once it is detected, then there are steps identified even by CSIR. So
Mhm.
CSIR invested a lot of effort. There was a high-powered committee which really looked at what would be the punishment or the action taken depending on the seriousness of the problem, because all problems are not at the same level, as you know. So they have also given that. So a
Mhm.
lot of thinking has gone into it.
Mhm.
All the cases which you are referring to or have in mind are much before these guidelines were there. So the sensitization is very high now.
Right.
So in the last few years, even before pandemic hit us, even before 2020 March, when pandemic hit us, or January 2020, this discussion was on,
Mhm.
because I was involved with the academies, and there have been now documents, and some cases have been examined, and some action. I don't know what action has been recorded, but there is a complete clarity that this is not tolerable. It's a zero tolerance issue.
Right, right, right. So the reason I brought it up with, in context of the pandemic is because when something is happening in real time, science is something that takes time to sort of verify and ensure, like it's not a very quick process in itself, scientific validation.
Sure.
And that's when, these issues come where you don't know that you just take a paper that has been
Absolutely.
published, in its face
Uh,
value.
no, absolutely right. Only good news is that if it is a poor quality data or the wrong data, it dies its own death very quickly. So
Right.
there is a law. The time it takes to do that
Mhm.
will also be the time when people will forget it.
That's why they say science is self-correcting.
It is already actually, this is something we know. If you have a wrong paper published, it will do you more harm than your 100 good papers.
Right, right,
So one paper is enough to spoil your reputation. So
right,
scientists are very careful and they have to be careful.
right, right. So, last question to you. Since then, you took up this office, you already have started the One Health mission. What do you think is the next frontier? What is the next push that Indian, science requires?
The other thing which we took up, but we need to go much more, is the deep tech startups. So the startups which are based on deep technology. That is what they call deep tech startup.
Mhm.
Now here in deep tech startup, it has to be based on very solid science
Right.
and technology. It cannot be just some small derivative of the existing one. It's
Mhm.
not that. And it is not a service oriented startup alone.
Mhm.
Service oriented startups are also important. I'm not saying that.
Mhm.
Country's strength will be much, much more enhanced when we are the leaders in deep tech startup.
Right. Could you give me an example of what would be a deep tech startup?
Oh, many of them. Supposing you want some startup for application, let's say in aerospace, for example, which requires some new materials to be developed.
Right.
Now, that is not a easy thing.
Mhm.
So the deep tech startup will work on making the new materials for that particular application.
Right.
Now, so the materials engineering, material science is one example other than the health science, which
Mhm.
all of us are probably more familiar.
Mhm.
So, advanced materials or functional materials, or whatever you may call it, new materials are the ones which will really occupy a very center stage in the development of nations' wealth.
Right.
For example, in the last few years, graphene has been very, very popular, right?
Mhm.
Two-dimensional form of carbon. Now, question is, what are the technologies, new technologies, which can come up based on that material?
Right.
Now, that will be a deep tech startup. Why?
Mhm.
Unless you know all the very critical properties of this material, you cannot think of a application.
Right.
So here the science and technology go hand in hand.
Right.
So that is what we are discussing now. How do we make the right ecosystem for deep tech startups? What are the policy decisions one need to take?
Mhm.
What we can recommend to the higher ups? What are the things which our researchers will need?
Mhm.
What are the, for example, in a deep tech startup, it's not that you can test something at home. No, you will need high-end equipments. You will need electron microscope. You will need atomic force microscope. Many things. Now you cannot put all that in one company. No, these
Right.
are very expensive. So
Mhm.
the question is, can the country be ready to do that? Good news is yes. So our office has started what is called iSTEM, ISTEM.
Okay.
iSTEM is a portal which you can go to, which is being hosted by Indian Institute of Science, Bangalore.
Mm-hmm.
But it is supported by our office. So what have we done? We have put all the equipments above a certain value, which have been funded by government sources on this platform, and asked people how much time they can spare for others.
Right.
So people can go to their website, that iSTEM,
Mm-hmm.
book the instruments, even for startups. It's not only for academic institutes. Anyone, you
Mm-hmm.
can do it, I can do it. And the arrangement has to be worked out with the institute.
Right.
Some institute will charge because they have to run the equipments and so on, very nominal cost.
Mm-hmm.
It's not a big cost. So that is one step in the right direction. Otherwise, you cannot do deep tech startups.
Right. Right.
Cannot do. So this is what our office has facilitated towards that. So this iStamp portal is already functioning actually.
Okay.
Instruments are already on it
Mm-hmm.
actually.
Okay. Okay. Okay.
So it's a very powerful platform which will grow with time.
Right.
So
Right.
it's a very integrated.
Right, right. Thank you so much, sir. Both the initiatives, the One Health and Deep Techs, it does sound like something that the country needs right now, and I do hope that both of these turn out to be successful, so that we as
Thank you.
a country and our scientific community can, make the most of it. Thank you so
Thank
much
you.
again for giving us your time, and we do hope to continue staying in touch with you over the
Absolutely.
course of your tenure.
Absolutely.
And
Absolutely. Let's be in touch. Thank you
yes,
so much
thank
for
you,
your
sir.
interest.
And to
Thank
our
you.
viewers, thank you for joining us. You can follow us on social media for the regular news updates. This is Mohana Basu, Special Correspondent at The Print, signing off.